Great being at the Anterior Hip Foundation meeting here in Nashville. We've had an incredible first day. These physicians are, some of them are some of our largest advocates and supporters of Corganics clinical CBD here in the US. They do an incredible job of really educating their patients and building around safety first and foremost for their patients, providing less risky prescriptions by incorporating multimodal approaches with Corganics. And we're seeing the fruits of that in their responses here on stage, but also sharing with some of their peers. We're excited to bring on new healthcare partners coming out of this meeting in Nashville.
So our patients are looking at the best outcomes, but they want to avoid the opioids and all the side effects of narcotics in their journey. And so it's good to give them all the opportunities that they are available to have a opioid-sparing type of pain management strategy afterwards. So patients are looking for that. If we don't provide something that's trusted and we know works as physicians, they're going to go look for something else by themselves, and they may or may not have any experience in that field. So it's always nice to have a trusted source that we've already used and vetted and that we can promote for our patients, that they have great options to optimize their recoveries. So as we've implemented Corganics, to our surprise, it's interesting to see how many patients actually are looking for such a tool. So even though we as surgeons may not be aware that patients are looking for this, once you provide it or give them access to it, what you find is it really is something that they want. They want something to avoid opioids. It's been a great add to the things that we can provide our patients. So patient satisfaction has been much higher as well.
The CBD is known to be an anti-inflammatory. So that's part of my gig. I'm known as the swelling guru for joint replacement. And so again, if it's anti-inflammatory, reducing those cytokines, that's what we're looking for. You know, what I find is that there are definitely a group of patients that they do not want opioids. When I can offer them a product that I know I can trust. In New York State, it's not regulated, and so I needed a product that I can trust. So, you know, that's where I met up with the Corganics team and said, can you give me something for my bus drivers, for my police officers? All these people have to know that it's THC free. So certainly we love NSAIDs because they're, you know, anti-inflammatory, but they have side effects, right? Kidney, GI particularly. You know, stress surgery increases stomach acid, and then now you're going to use baby aspirin, so that can irritate the stomach. Now you're going to add NSAIDs on top of that, so the GI bleed risk is real. On top of that, a lot of my patients have had gastric bypass, so they cannot take NSAIDs. So this offers a great opportunity to have something that's anti-inflammatory that also helps improve pain that the patients can feel confident about.